Hey, deserving listeners, I came across this article on the American Psychological Association website, and I thought that I would critique it. My name is Dr. Kirk Honda. I'm a therapist and a professor, and this is the Psychology in Seattle podcast and YouTube channel. The article is written by Anna Medeiros, and it is titled 7 of the Most Frequently Misused Psychological Terms. 7 of the most frequently misused psychological terms. All right, so let's look this over. Okay, so the first term is triggering, and the author is quoting from Aaron Parks, PhD, saying, in our pop psych TikTok culture, in our pop psych why is this a tongue twister? In our pop psych TikTok culture, say that 5 times in a row, triggers are something to be avoided or put upon the other person to remove. Triggers are something to be avoided or put upon the other person to remove. Yeah. As in, you are triggering me, so stop doing that. But, and this is Aaron Parks, PhD, continuing by saying, but in eating disorder treatment, triggers are something to be aware of and overcome. So how can we figure out what triggers my urge to engage in eating disorder behavior? And then what are the skills I'm going to use to combat that urge? End of quote. Yeah, so the term triggering is complicated because there's a lot of different usages. And as I sat down to record this episode, I thought that I would formalize my criteria for misused psychological terms because I've been observing this for decades and more so with the advent of social media in the last 20 years and more recently in the last 5 or 10 years because I will interact with people on YouTube and on social media with this podcast and will have to push back on the misuse of terms. And so I, at first, would just blanch when I would hear someone use a word in an incorrect way, especially if I heard multiple people in different contexts, which pointed at a cultural movement, if you will, that was out of control, out of the control of us clinicians, us who understand the meaning of these terms. Words like gaslighting, this kind of thing. And at first, I just would say, these people don't know what they're talking about, and I would just criticize it and move on. But then I, over time, started to develop why is it that it's bad? Because words change over time. A lot of the words, every word that we use currently had a different meaning, or it had a more nuanced meaning in the past, or it was literally just an invented word, like the word literally, how that word has evolved over time. And we have to understand that and know that you can't fix a language to a particular point in time. Things start to move forward. And words like LOL, when that first came forward, I remember there's a lot of pushback. And by that point, I had understood that language changes, and a lot of our words today were deemed to be quite silly words as they were introduced to culture. So why would a word like LOL be any different? That word, if it persists, it'll start being, people writing serious literature will use LOL in the future. You know what I mean? So it just is an understanding of linguistics and history and that kind of stuff. And also privilege, because often the people that are pointing, who are turning their nose up and pointing a finger at other people who are quote unquote misusing words are the privileged people, in my society, it's white, rich people, white, rich, educated people. So we want to be careful about that. And I came up with the following criteria regarding whether or not I, and I would recommend others, push back on the misuse of terms. So one is the word actually being misused? Because sometimes, like I see trauma is the next word here, sometimes people have, within the clinical world, they will have a narrow definition of the word. Like, Aaron Park's PhD, I don't know. I'm guessing that this individual understands all the different usages of the word triggering, but this person is only presenting one sliver of the pie. It is the usage in eating disorder treatment. But triggering, of course, is used in trauma treatment and other kinds of treatment like chemical dependency. So the first criterion is the word actually being misused? Then if it is being misused, if there's a trend, and I guess the other criterion is this just an isolated event? Is this just one person that misunderstands a word? This reminds me of a story. Forgive me for this tangent. But when I was in high school, we were playing Pictionary because that was a big deal in the 80s. And I was playing it with my family, and me and my cousin, who I'm very close with, Brian, he and I were on a team together. And this word came up. It was one of the there's like you land on a thing and it's like an all play, but it's a hard word. Anyway, it was lobotomy. And everyone, because all the drawers are secretly looking at this card. They're like, ooh, lobotomy. I mean, how do you draw that? Well, Brian is drawing, my cousin, for me, and he looks at it and he's like, oh, well, that's easy. But he's looking around like, is it okay that we're talking about this? And so he draws a stick figure with an axe coming down on a man, and his member is being chopped off, and there's blood. And I immediately quietly realize what it is, and I whisper, lobotomy? Is that? Because I knew I thought that we both thought that's what it was. And we were shy because we thought, well, we're with our parents and our aunts and uncles and our grandparents. We're talking about lobotomies, right? We did not know the definition of the term, but we both had a different definition of the term. How did we know? Well, the rest of the family were astonished that we got lobotomy so quickly, and they look at us, they're like, how did you get it? And they try to see how Brian drew it, and Brian was covering it up like, oh, no, look at this. And they get a hold of it, and they look at it, and they burst out laughing, and they say, so what do you think a lobotomy is? And me and Brian both say what we think it is, and they're like, that's not what it is. It's this other thing. And they are asking us, how did you both think that lobotomy was this other thing? Because it's far from it. And we figured out that Brian's older brother, Lance, who is, older than both of us, he somehow came to that conclusion or was told by someone, and he told the two of us. And since he's an older relative, we just believed him, and that's where we got that from. So to have one person misunderstand a word is just one person misunderstanding a word. To have a group of people misunderstanding a word, well, now we have potentially an issue that we have to look at. So is it actually being misused? And is it a group of people? Is it a cultural phenomenon? The other questions, the other criteria to ask ourselves is, does this misuse of the term compromise language and concept precision? When we have a word like gaslighting or OCD or ADHD, when there is fuzzy edges around the definition of these terms, does that compromise our ability to communicate and understand what we're talking about? It's like the word literally. Originally, and I'm not a linguist, but my understanding from use and from reading the dictionary is that literally meant that it is actually, right? That you are actually, if someone said, I'm trying to think of a metaphor, I was going to say blow my mind, but that would be a bad literally thing. But if someone read every word of the Bible, for example, and you were to say, he actually read every word of the Bible, and you were concerned that the person that you're saying this to might think you're kind of exaggerating, that he didn't read every single word. So you want to really emphasize it, and you would either use actually or literally. You'd say, no, he literally read every single word in the Bible. Okay. Then, over time, rather recently, people started using literally to not mean actually. It was just a marker for to be, I don't know, I'm sure people would have words for this, but it's to just emphasize something, like he literally blew my mind, right? I actually was doing this last night. My friend was misunderstanding me, and we were sort of joking around. And I said, I literally wasn't saying that. I literally wasn't saying that. What's the literally mean exactly? I think all I needed to say was I wasn't saying that. But I used the word literally to make it stronger, which is kind of a ridiculous, superfluous use of the term, right? I should just, in my preference of language, I think we should try to be precise. And so, anyway, does the use of gaslighting or trauma, does the misuse of these terms, does it take away from our ability to precisely communicate something? Because if I say gaslighting, for example, 10 years ago, for those who knew what the term meant, they would know what I meant by it. But today, if I say gaslighting or love bombing or something, then I have to clarify it, because the meaning of that word, even among clinicians, has essentially lost its meaning. So the word no longer is helpful as a communication device. Other words, like, I suppose, racism, these kinds of, to be a racist, if you actually look at all the different usages of the term, at least in my cultural pocket, if I heard a coworker accuse another coworker of being a racist 20 years ago, I would guess that I would understand what that person meant by that. Today, if I heard someone accusing someone else of being a racist, I would have a lot of follow-up questions. And maybe I would assume, maybe they are, in my book, a racist, or the accusation I would agree with, but with how the word is being used today, I wouldn't know that necessarily. So precision in language is important. Communication is important. And sometimes the people in power, not in a Machiavellian sense, not in a planned way, but they actually benefit by us losing precision in language, because a lot of the words that we use are helpful for the oppressed, for people in need. Things like the word racist or something, or gaslighting. When we lose precision in our ability to communicate about these things, then we lose the power of being able to understand that other people are being harmed. A lot of these terms have to do with that. Trauma, grooming, these kinds of words. When we dilute them sufficiently, then we lose the ability to help the people who are being harmed in this way, or we lose our ability to advocate for ourselves, because they just become these bland words that are being used in all sorts of other ways, exaggeratory ways, false ways, a narcissist, these kinds of words. So one of the criteria that I have is, does it compromise language precision? Another criterion is, does it lead to misinformation? Like with trauma bonding, for example, does that misuse spread just misinformation, where you would read an article about a prisoner trauma bonding with their the prison guards or something, and because this false definition has been spread around, might the reader of that article just completely misunderstand, and might that lead to harm? That's a possibility. Now, the other criterion that I'm mainly focusing on when it comes to the misuse of psychology terms is, does it cause harm? Particularly, does it cause harm to people who actually are experiencing or having of these conditions? Like, does it minimize their experience? Like people with legit OCD, when you hear people saying, oh my God, I'm so OCD, and all they are is just a little tidy or a little particular about something, people with OCD will report, which I understand, that it hurts their feelings. It makes them feel like they are overblowing it, right? That they shouldn't complain so much, because all it is, everyone seems to have a little OCD. What's the big deal? How come I'm complaining so much? How come I can't get over it, or something like that? Or when I say I have OCD to people, I want people to understand that it's severe, right? In the medical world, I suppose it'd be sort of like, if you had a mild, I don't know, like a temporary condition, like a temporary pain in your knee or something, and it lasted for a couple of days, and it was pretty transient and minimal in intensity. And everyone walked around saying, "Oh my God, the cancer in my knee is giving me trouble today." Well, you can imagine a lot of people with legit cancer currently or in the past would feel like, use a different word, please, because to me, when I hear cancer, that is, that's a big deal. And at first I thought you actually had cancer, which caused me to want to really take care of you and understand what's happening. But now I realize that you just have this small little pain. And also, is that what you think when I told you I had cancer? Is that what you think that I was going through, was just transient, minimal, temporary pain? Because that's not what cancer is. It's the same. That's very analogous to when someone says, I'm so OCD, or I'm so ADHD, this kind of stuff. Or that person's so bipolar, just meaning that they're minimally moody or something, or they're perceived that way. So it's harmful to people. So when people misuse terms, if people are being harmed, then I'm going to draw a line there. It's not okay. And when language drifts, okay, but some language drifts are also not okay. Just because we understand that language drifts over time and it changes doesn't mean that every drift of language is on the up and up, and doesn't mean that we shouldn't push back on some words, right? Another criterion of harm is, does it cause stigma, which I'll get into later. So let's actually review the various different terms in this article. And I'm actually going to, I'm guessing, provide my own terms, because 7 is not enough terms. But first, let's take a break, or back from the break. So another thing before we, there's all these things that I feel like need to be stated up front, because the premises and the assumptions is what all this is standing on. The foundation of a discussion of misuse of terms involves a lot of assumptions. And one of the assumptions that I want to add, in addition to what I've already discussed, is, well, who decides what a word means? And that's a very good question, and it's impossible to answer in a concrete way. But what I tend to do, not all the time, but what I tend to do is I look in the clinical literature, the published articles in respectable psychological journals that involve the use of the term, especially if in those articles they formally define it, and especially if they refer back to a foundational definition. It's very common, like if you have an article on gaslighting, it's very common and good practice for authors and researchers to formally define what gaslighting means, instead of just assuming that through context you're going to figure it out as the reader. And it's also helpful to establish who first coined the term, or who first established this consensus definition. So there's that word consensus, right? Because within the field of psychology and within the field of research, any term is going to be used in a variety of ways, potentially. But what is the consensus, right? And how do we define the consensus? Because we don't have consensus police. We don't have a consensus committee. We just informally develop a consensus around certain terms. Now, a lot of our terms are in the DSM, right? The Diagnostic Manual, or the ICD. And these are pointed to as a cornerstone of conditions and terms like narcissism, narcissistic personality disorder. But I think that although we should be looking to the DSM as a cornerstone, it's not the only cornerstone, and it isn't the only way of describing things. For example, with narcissistic personality disorder, the DSM is concerned with observable behaviors, not with the internal experience, which, without understanding that and defining it as an internal experience, then misunderstanding will occur, like with all personality disorders. To just read the DSM regarding personality disorder, which a lot of people will do, even clinicians on the internet, is to really miss the mark in terms of understanding what a personality disorder is and how it operates, how it develops, all that kind of stuff. And once I learned clinically, just through experience mostly, I actually was like, oh, actually, to read the DSM is a starting point, but now I understand, finally I understand what a personality disorder is, because I interact with people and I get the history and I get the way that they think. I get the way that they feel, the way they perceive, the way they distort. And now I understand where all those behaviors that are identified in the DSM. Anyway, so when it comes to defining a word like triggering or trauma or OCD or narcissist, what do we mean by that? Within the clinical world, like with narcissism, there are a variety of definitions. There's a variety of usages that are all legit, which really confuses things, not only for us clinicians, but particularly for the public. But anyway, so the other foundational thing here is who defines what the word means? And the answer for me is the collective consensus that is reasonably derived once you read a representative sample of the published journal articles in respected journals. And actually, I should give another caveat here. There's so many caveats, but I think it's important in that how can clinicians know confidently all of these definitions to all these various terms? I mean, I'm going to get into about 15 to 20 terms here, but this is just a list of the commonly misused terms that at least I've seen in our culture. But there are hundreds, if not thousands, of other terms that are in the field of psychology and psychotherapy. How can we all understand? You would think from the outside that we would have a dictionary or an online resource where there's a central database, if you will, or a central set of definitions that everyone agrees upon. That does not exist. You would think it would, but it doesn't. And maybe it should, but it's hard. So if you're a clinician, how in the world are you going to have the time to look up all, because in order to understand the consensus, you have to absorb and find first, you have to find, but then you have to absorb and maybe take notes on all the various different usages, and the definitions that are in the clinical literature. How are you supposed to do that? It's time consuming. For a lot of clinicians, they might not even know where to begin because it's not easy to do. You can't just type in gaslighting into a research database and expect very quickly to get a small set of articles that will help you. You've got to sift through a lot of search results, and you have to know how to use these things. You have to know how to interpret the articles that you're reading. You have to understand other terms, other usages, so that when it's being used, you understand what they're getting at, this kind of stuff. So how is everyone supposed to, I don't know. I don't answer. What I do is I spend the time doing it. But why do I spend the time doing it? Well, because I get paid to do that as a professor and a podcaster. I literally get paid to know shit so that I can tell you that shit. And I'll tell you that before, when I was mostly just a practitioner, I did not have that time. I was working all day long and then commute and doing all your chores and trying to get your life together. You don't want to spend a few hours every night searching on an internet database, which also costs money. It's expensive to have access to the journals outside of academia. As a professor, I've always had access, so there's that. Anyway, so it's hard. And I have made it my job when I have students and supervisees to know this stuff so that I can help them with it. But not everyone has someone like that in their life. If you are a clinician, I recommend that you have a mentor that is wise and knowledgeable and maybe even paid to pay attention to you and to make sure that you're not being misled. So I just want to get that up front. So let's get into triggering. So the first word that the APA article goes into is triggering, and mostly what they're saying here is that, they say the misuse here is You are triggering me, so stop doing that. I don't think that's a great depiction of its misuse. I know what they're getting at, but the misuse that I will see is when, along these lines, is that someone will not like a topic. They will be uncomfortable, and they are not reacting out of PTSD or some eating disorder being triggered. They just don't like the topic. They are uncomfortable with it. It makes them upset. Or, to hear if you're a liberal and you are in a college course and there's a guest lecturer who is going to talk about the pros and cons of being a Republican. Maybe a Republican comes in and starts talking about how Republicans are great or something. And someone in the class, a student, just doesn't like that topic and is, maybe understandably a little upset, a little angered, a little bothered, but they're not having a trauma reaction. To say that they're being triggered could arguably be a misappropriation of the term. One could say the individual is trying to capitalize on the suffering of others as a way to just push something away that they don't like, or they just don't understand the word triggering because they saw another student who said they were triggered by a scene in a movie. Another common scenario for a legitimate use of the word triggering is when you are, say, you're in a college course and the professor, as a part of, maybe it's a course on film, and they show a scene of sexual assault in a movie, and it's graphic. Like, I always think about the scene from, well, first is Irreversible, which is just horrible, and then the other one is the girl with the dragon tattoo. I think both versions will depict. And so for people who have PTSD that could be triggered from that, it could be horrific. The psychological tailspin that it can cause for an individual is horrific. They might dissociate, they might be depressed and physiologically harmed, neurologically harmed for weeks, if not months. It could cause depression, it could cause avoidance, it can cause severe anxiety, it could cause them to resort to addiction as a way of self-medicating or something. And so trigger warnings are needed in those situations. By the way, if you have trauma reactivity regarding depictions of sexual assault, there's a scene in this movie that is pretty graphic, and so feel free to not come to class today. Because the other principle about triggering is you don't want to, because this is often the case, is the professor will be, say, watching the scene, and then they'll pause it and say, oh, by the way, there's a scene of sexual assault coming up, and so trigger warning. Well, that is too stressful for an individual in the audience, because they would have to stand up in the middle of the crowd and walk out while everyone's looking at them, right? So you have to tell them in advance so they just don't come into the classroom, that kind of stuff. Anyway, so people will see that and not really understand what's happening, and they'll go, oh, so if you're uncomfortable with something, then you just say it's triggering, and then you can get out of it. And that's not what's happening, right? So legitimate usages of the term, they're identifying one, which is with eating disorder behaviors that are being triggered by something. And other other definitions of the word triggering in this category would be addiction triggering, right? So say that you're trying to abstain from alcohol and you walk into a bar. That could be triggering, right? Or when you are sad, say you get broken up with, someone divorces you, or you find out that your spouse is cheating, that can trigger one's addiction, right? Okay, and I think that's a legitimate use of the word triggering, and I think that's a use in the clinical literature. Another category is that of PTSD that I've already gone over. I think it deserves its own definition here, or its own sub-definition, in that I already described it all. and that can apply to any type of PTSD. There are common triggers like sexual assault or violence, or I'm trying to think of another common PTSD triggering moment. Those are off the top. And by the way, I'm not going to give an exhaustive dissertation level exploration of each term. I'm just sort of highlighting the the highlights so that we can get through all these terms, 15 to 20 terms. Anyway, another triggering is of an unwanted psychological reaction, as I'm putting it, like OCD or mania or psychosis or suicidal thoughts, this kind of thing. That can be triggered, and we will use words like that, like, oh, did that trigger your OCD? Meaning that if you have germ phobia, as a part of your OCD, and you are at work and someone sneezes in your vicinity or something, that can be triggering for someone. Another use, though, is to use it, like I was using it before, of stress in their, say someone's recovering from OCD and they're doing pretty well, but then their loved one dies, and that can trigger one's OCD, that kind of stuff. And I think that's legit. And then that other category is that of compulsive behavior, like an eating disorder compulsion or an addiction compulsion, this kind of stuff. So that's triggering. And is it misused? Mm-hmm. So does it compromise language precision? I would say yes, because you have one student standing up and saying, I'm being triggered, and another saying, I'm being triggered, and we wouldn't know what they meant by that. So we want to push back on people misusing that term so that when someone is legitimately being triggered, they're allowed to use that word, and also for trigger warnings and for the public discourse around triggering, because one of the problems is that you'll have people, I think understandably, will just throw out the word and think it's ridiculous, that it's just like a snowflake thing, right? And they just disregard the whole enterprise of trigger warnings, which is not okay. And so for us as clinicians, or for those of you interested in psychology, it's within everyone's interest that we protect the definitions of these words and that we say that's not an appropriate use of that term. It's not an accurate use of that term. Just say you're uncomfortable with something. If you're uncomfortable, that's okay. You can say, I'm uncomfortable. That's another part of this, is that, getting back to the systems of power, is that people will exaggerate terms as a way to try to get some agency in the world. And they aren't listened to otherwise, right? They see, ooh, that word has power. I'm going to use it because I don't have power, generally speaking. I can't stand up and say, I don't like this situation. I'm uncomfortable. This is upsetting to me. Now, of course, people would say that people need to be resilient to certain situations. And, it's case by case. But anyway, so I think with the word triggering, we should push back. Does it cause harm? Yeah, I would imagine it does. It's hard to quantify. Other words are, I think, more harmful to people that are misused, like OCD or gaslighting, this kind of thing. So when I think about where the word triggering ranks with other misused terms, in my anecdotal experience, people are less concerned about triggering being misused than other terms. For those who understand themselves or use that term triggering in their own lives and they're using it legitimately, I don't hear them, but this is just my cultural pocket, I don't hear them complaining about feeling hurt when other people are using that word inaccurately. They might point and say that's not the appropriate use of that term, but it might not make them feel as stigmatized or as minimized as with other examples, like with OCD or with ADHD or with gaslighting, which I'll get into in a second. But first, let's take a break. All right, we're back from the break. So if I'm going to get through this today, I have to go faster. But it's hard because there's so many caveats. All right, so the next word in this article is trauma. And there's a quote from Konstantin Kushlev, PhD. And the quote is, there is a phenomenon in language where words over time basically lose their original meaning. And I think in some ways that process is happening to the word trauma. Trauma is being used as something that persists over time, like there may be a particular experience that years later you haven't resolved, but any negative childhood experience isn't necessarily traumatic. End of quote. So I'm not a fan of the way this article is being written. It's just a compilation of quotes from various different experts or supposed experts, and it doesn't give context. I would have wished that the author would actually just use the quotes as a way of supporting their arguments or something, but because it's not exactly, because what happens, and I have participated in these interviews, is they email you to set up an interview, and then you talk with them for an hour on the phone usually, and then they just take a little snippet from what you talked about and use it in their article. And you're just talking off the top of your head. You're not actually giving a concise argument. But this individual, I think, is basically saying that so when it comes to trauma and the word and the history, you could spend your whole clinical life researching and talking about this, and you would never run out of stuff to talk about. So it's a large topic. Generally speaking, because it's hard to summarize this, trauma originally meant physical harm. Like if you had a gunshot, that would be a trauma to the body. You would hear medical professionals using it in that way, like a trauma unit, meaning it's a medical unit that is specialized in helping people that have physical trauma, not things like the common cold or ongoing issues like cancer. So it would be car accidents and other kinds of physical harm that is happening to people. So that was the original use of the term going back, I think maybe even hundreds of years, I'm not sure. But then in the psychological world in the late 19th century, by individuals like Freud, they started, because they were medical professionals themselves and would use the word trauma in their medical discussions, started to use the word trauma to refer to psychological trauma, because they didn't have a word for the harm that can happen from events psychologically, emotionally for us. Things like being assaulted or sexually assaulted, or being rejected, abandoned, this kind of stuff. So we started to use that word, and also there was war stress and war trauma that was not physical. It was psychological, and we saw the result of that, sometimes physical, but often in behaviors. People would exhibit behaviors and would discuss and disclose internal experiences that were the result of having been exposed to war. And they might not have ever been physically injured, but they're psychologically injured. So they started calling it war trauma. And then they started to use terms like post-traumatic stress disorder, this kind of stuff. So that's a very short discussion of that. And eventually the word trauma started to be adopted by people that or one could say that Freud actually originally used trauma to be more broad. So, okay, when something is included in the DSM, it tends to rally a lot of people around that single definition. Things like dissociate and other terms like this originally were more general within the field of psychoanalysis and psychology in general. But once it becomes formalized in the DSM, then a lot of people will, in my world, will say that that is the only legitimate use. But in reality, the DSM is just looking toward the way a word is being used, and they're using that word in their diagnostic language. So words like dissociate or trauma had a more general definition prior to its more specific use in the DSM. I hope that makes sense. And so decades later, people would say that, oh, well, you can't use the word trauma or dissociate outside of the DSM, thinking that the DSM invented it, and they didn't. They don't claim to have invented it. So that's another issue, and case by case. But with the word trauma, I think has its use. I mean, because we don't really have another word, because maybe that's another criteria or consideration, is that do we have a better word for the usage, right? If we're trying, so let me describe what generally people talk about in my field, where they call it uppercase T trauma and lowercase t trauma, or capital T trauma and lowercase t trauma. So uppercase or lower or capital T trauma that is, people will literally say that. Sometimes in research literature, they will say, so when someone experiences a capital T trauma, what they're referring to is the kinds of psychological trauma of going through something of a serious threat to your safety or life or your body or your physical integrity, this kind of thing. Like being in a serious car accident where you almost died, or being in war, someone is shooting at you, watching someone die next to you, being sexually assaulted, this kind of thing. So this is usually what we're referring to when we're talking about capital T. And I think that's what this person that they're quoting is referring to. They're actually talking about trauma as only legitimately being used with capital T trauma. Lowercase t trauma are things like having a critical parent, or having your parents go through divorce and one of your parents moves out of the state and you don't see them anymore and you feel abandoned. So you don't feel at least overtly physically in danger, but it does have long-lasting psychological harm that you can point to. And it's not necessarily less intense. Sometimes people will say that lowercase t trauma is less intense, it's less harmful. That is not necessarily true. You can go through a capital T trauma, like watching someone die next to you, and it can be harmful, and you can develop maybe mild PTSD, but that recovery might be, with proper treatment, might be a few months. Whereas if you go through, like I said, abandonment of one of your parents, it might be so pervasive to how you see the world and yourself and your sense of safety, your sense of stability in life, that no amount of therapy will ever fully counteract the negative ongoing effects that you have from that. And, and that's unfortunately, the case. My dog is barking. So lowercase t trauma isn't necessarily less intense or easier to recover from or more preferred or something. So there's that. Now, do we have another word for lowercase t trauma? Can we just find another word? And I don't have one. And again, I'm not doing an exhaustive search for this sort of thing. So yeah, some people will think, and I think that this is what this individual being quoted thinks, is that lowercase t trauma is not a legitimate use of the word trauma. And I am not a fan of that perspective. I think it can be easily caveated or elaborated on so that everyone understands what we mean. And I think it is an old school way of thinking that basically downplays the psychological harm of what is termed lowercase t trauma. I mean, even if we just look at the term, right? There's capital T, which is legit and big, and you have lowercase t trauma, which, it's not really trauma. It's just sort of soft trauma or something. It depends on what, and I could understand, if someone grew up using trauma only in one context and just using other terms like psychological harm or psychological effects or something, then maybe. But I think it actually stems from an overall misunderstanding or downplay of the effects of what we call lowercase t trauma. To be abandoned can have profound effects on an individual's personality and on their life. And also uppercase T trauma can as well. But as I said, it doesn't necessarily mean that it's always going to be more intensive. To me, it's just a different form of harm. It's a different, every harm has its own characteristics to it. Anyway, so I think it is this maybe even a paternalistic way of thinking that, oh, get over it. It's not that big of a deal. You're just being too sensitive. Okay, so what? You had a critical mother. Move on in life. That kind of thinking, I think, and I don't want to accuse this person of that, but I'm just saying that this is my sense. Because, culture and vibe play a role in all of this discussion, even in my field. So there's that. Now, how are people misusing the word trauma? Well, I think that online discussions will claim that to use lowercase t trauma as a legitimate use of the word trauma, they will say that's misusing the word trauma, and I think that is not correct. I think that in order for us to be precise, we might have to clarify and say that the trauma that someone went through involved physical safety concerns such that they developed a trauma reactivity that was reflective of that, like with PTSD or something like that. Whereas the trauma that someone experienced because they had a critical parent is affecting their psychology and their personality and their behavior and their reactivity and their working models of self and other in a negative way, that those things have been harmed by that experience. I just think that in context, you can tell how someone is using it. I don't think it downplays uppercase T trauma, because I think that's another thing that is being proposed, is that lowercase t trauma usages will diminish uppercase T trauma. And I just don't think that's true. Now, what is a legitimate misuse of the term is people saying things like, "Oh my God, they canceled my favorite TV show on Netflix. I'm so traumatized." It's not, maybe there's a chance. Maybe there's a way they could convince me if they're that attached to that TV show, maybe, but not likely. It's likely that the individual is just bummed out. They're just sad. They're upset about it. And they're using the word trauma because they've heard other people use that, or they're trying to emphasize that it's a really big deal to them. And that is, I think, an imprecise misuse of the term. So then we ask ourselves, does it lead to lack of precision? Yeah, I don't know. I don't see a lot of people misusing the term trauma in that way, but there are those. Words like gaslighting, or narcissist are so, in my anecdotal experience, 99.9% of the time it is being misused, even by clinicians, words like gaslighting and narcissist. Whereas words like trauma, I don't see it that often. But whereas words like gaslighting and narcissist, they're being misused so often that there's a small pocket of people that understand the usage of the term. Whereas the word like trauma, I just don't see that. So anyway, that's one consideration. The other is it diminishing and minimizing the experience of others when people use it in this frivolous way? I don't hear people complaining about. Is it? Yes, but does it actually hurt those individuals? Well, I suppose by an extension, there is a misuse of the term PTSD. People will say, "Oh my God, I have PTSD because I once ate a bad piece of sushi and it was rancid and I have PTSD, so I can't eat sushi anymore." And yeah, maybe you have a gag reflex or something, and it's possible to actually have trauma from an experience like that. It depends on your current, upon being triggered, it depends on the intensity of the reaction, and it's a bit subjective, and there's a lot of gray zone there potentially, but generally speaking, it's probably not actual trauma reactivity and probably not PTSD from that. And so for someone to say that they have PTSD from that, I think that specifically I hear from people saying that will hurt their feelings. And I think that's legit. And we have so many other words. That's what I always say about OCD. We have other words. Just say you're tidy. Just say that you're anal, right? Anal is an old technical term, but people generally don't use that anymore. And I don't know anyone who considers themselves to be anal retentive in the Freudian sense today. I don't know anyone, just full stop. And even if I did, I can't imagine them being upset by someone using that term in a more light way. Anyway, so there's just so many other words. So if you were affected by eating bad sushi, and now when you think about sushi or you see sushi, you're just like, I don't want to eat it. Just say you're affected, or you have what's another word, like having that bad piece of sushi just really turned me off to sushi. I don't know. There's just other terms, and I understand why people would say traumatized, because it really gets to the point, but it's not an accurate use of the term. Anyway, all right. So the third word in this article is obsessive compulsive disorder, and there's a quote from Daniel Chazin, PTSD. Quote, "Among the general public, the term is used to suggest diligence and particularity, and it supposedly reflects chosen behavior. But in actuality, OCD refers to a clinical condition characterized by repetitive, intrusive thoughts, fears, doubting of one's own experiences, and compulsive routines and mental behaviors that people do not choose but are compelled to do. Altogether, the condition is one that causes quite a bit of suffering. End of quote. Yeah, I couldn't have said it better myself, and I've already touched on this one. So yeah, this is the first item on this article that I'm fully in line with and don't have to elaborate on. So let's go to the fourth word, self-care. This is a quote from Tekla Broomder-Ross, PhD. Quote, "I think self-care has been taken over by capitalism and is fed to us as a laundry list of to-dos." Just chiming in. Yeah, I mean, I don't see it that often because my algorithm doesn't show me that kind of stuff, but I know that other algorithms do. And of course, capitalism would get involved, because if you are trying to sell a product that has supposed relaxation qualities, or if you're trying to sell a vacation package to a particular kind of person, then you are going to use all the marketing tools that you can get your hands on, and self-care being a trend or being a leverage, a lever that you can pull on people, then capitalists are going to capitalize. Going on, there's exercise and nutrition and sleep and boundaries and bubble baths. While it's beneficial to include those things in daily life, self-care shouldn't be used as a proxy for self-compassion. There's a being versus doing distinction. You can go through the motions of self-care without having any self-compassion. End of quote. Yeah, I agree with that. I don't usually run up against this. In fact, this is kind of new. I mean, I've thought about this before, and I thought about it not in the sense of capitalism, but as self-care became more trendy just among clinicians to talk about, I don't know, I would say like 15 years ago, I noticed that even for myself, because I would often be talking about it with my supervisees and students, because being a novice clinician is one of the most stressful things you could ever go through. And people, budding therapists, novice therapists tend to come from a life in which they listen to other people's thoughts and feelings and emotions in their personal life. So they're not used to depending on other people. And when they start to absorb a lot of stress just of changing careers to be a therapist, but also just absorbing all the trauma of their clients, they necessarily need to start depending on other people in their personal life and, therapists, this kind of thing. And they're not used to doing that. And so self-care, is an important topic, and people will burn out. One of the worst things that happens from burnout is lack of compassion, lack of empathy for anyone, let alone your clients. So it is a concern. So, we talk about self-care, and I would notice that I and others, when we talked about self-care, it would often be reduced to these very common behaviors like, for me, self-care is going on a hike or something like that. And I'd be okay. And of course, that's legit. But you can't go on a hike in the middle of your workday, typically, right? And given that you're in graduate school and you have a full-time job and you have 3 kids and you are at an internship site and you're stressed out, you might not have time to hike until you graduate. So there needs to be other kinds of things that don't actually involve much time, things that don't involve you to have a whole day off of work, this kind of thing. And so self-care is a general topic that conceptually does include things like self-compassion and doesn't necessarily mean a to-do list, right? Hobbies and Instagram moments, this kind of stuff. So the original usage of it, and I would notice that there's this natural reduction because you want to have an easy answer. I would be talking with my students, and you just want a quick way of resolving one's burnout and stress. And you think, okay, hikes, and okay, you're going to take a hike maybe sometime in the future, and let's move on. with another topic, and I would find myself doing that, and I would think, no, wait, I don't know if that's going to work exactly. And so I would push the students, and it requires a bit of a paradigm shift, and maybe even for non-clinicians, I'm guessing this is true, is that you can't just say, okay, self-care, I'll add that to my to-do list. For a lot of people, it requires a profound shift in your paradigm, in the way that you see who you are and what you deserve. To not be in connection with your needs because you were never allowed to do that, and you never had the mirroring growing up from your caregivers, you might not know what to take care of when you engage in self-care. When I say take care of yourself at the end of every episode, I mean it. And a part of that is, if you have to, that means just getting to know what to take care of. What are you feeling? Who are you? That connection with the self, right? So it can be a profound thing. And I think for a lot of us who have been brainwashed by the capitalistic system of our society, it's a shift. And I'll speak for myself that when I think about taking care of myself globally, what I often bump up against is that it flies in the face of productivity. It flies in the face of work productivity or earning money or something, right? Because it often will take away from work, right? From earning money and paying your bills. And that is very anti-American and anti-Asian, if I might speak for myself in that way as well. And so it's uncomfortable, right? It's not simply just reminding myself to have self-care. I have to fundamentally rework how I see the world, how I see myself, what I value. I have to maybe dismantle certain assumptions about what is good in life, So yeah, that's self-care. But again, I don't see people necessarily misusing that, like when they misuse narcissist or gaslighting. And I'm looking, to the rest of this, and the other terms, they have imposter syndrome, and they have bipolar, and they have gaslighting. They don't have narcissist. Why? How in the world do they not have narcissist on this list? I mean, that's the number one. Number one is narcissist. Number two is gaslighting. Love bombing should be on here as well, which I'll get into in a second. But anyway, so imposter phenomenon or imposter syndrome. This is a quote from Taisha Caldwell-Harvey, PhD. Quote, "The one that really gets me going is how the media has completely taken over imposter syndrome. I do a lot of work supporting the Black community and folks of color, and that concept can be really empowering when someone has a language to talk about what they're feeling in a work setting in particular. But the way that this word has taken a life of its own, it's turned into something really negative." End of quote. Again, without context or elaboration from the author, I don't know what this Caldwell-Harvey individual, I'm sure there's an explanation. So the one that really gets me, I do a lot of work supporting the Black community, the concept of imposter. Yeah. So for people of color, or if you are not stereotypically considered to be, if you have like a male nurse, for example, then you're not the stereotype. And so you can feel like an imposter. But imposter syndrome is not just relegated to cultural stereotype or to feeling like you're not among your people. Imposter syndrome is a more general concept that has to do with the feeling of being an imposter. Not literally an imposter, but sometimes literally an imposter. But it's the feeling that is, I'm coming up with a definition off the top of my head. So excuse me if this is imprecise or maybe even off the mark. I'll just give, because it is an actual psychological concept that I have not looked up all of the journal articles on. So I've looked up some anyway. So take everything I'm about to say with a grain of salt. That the sense that I have of the definition is that it's the feeling that one has. It's usually a bit long term. It's not just like a moment, right? It spans weeks, months, years, in which an individual falsely feels like they don't belong in that position, usually in a work position, right? So in my world, a lot of therapists, novice therapists, will have imposter syndrome, and it'll be pretty severe, and it will have negative effects. Maybe that's another aspect to the definition, is that there are negative effects from it. And it'll affect the individual's self-esteem, or it'll make them unsure about their impulses and their decisions. And so with novice clinicians, they'll often feel like, because to be a therapist is so overwhelmingly complex, and there's so much responsibility that novice clinicians will just feel like, because they look at other clinicians, particularly senior clinicians, particularly professors, which is not a good thing for students to do, because we have, professors by our position typically, hopefully, have a lot of experience and are paid to know stuff, and also may not actually talk about our insecurities, which I found I needed to do. I didn't realize I needed to do that, but when I started doing it occasionally, just sort of haphazardly, I would get this huge reaction, positive reaction from the students. Oh my God, thank you. I look up to you so greatly. And I'd be like, don't look up to me. I mean, I know stuff because that's why I'm teaching this class, but I'm just as aimless as everyone else is. It's just an overwhelming experience to be a therapist and to be a professor too. So, don't think that I have it all figured out. It's not even close. So for novice clinicians, they'll look at their professors and they just, oh my God, they seem to have it all. Look at me. I'm already practicing at an internship or postgrad. I have no idea what I'm doing from minute to minute. I must be an imposter, so I have to act like I know what I'm doing. And it can cause all these problems, like actually people feeling like they have to act like they know everything. And I've seen this before. And as a way to counteract being seen as an imposter, right? So they will have a hard time taking feedback. They won't seek information because they don't want to be seen looking up information. You know what I mean? Anyway, so this individual, so I'm wondering what they see it being used, because I'm off the top of my head, I didn't know this would be on this list. I thought it'd be all the things that I usually talk about, but so from context, I don't know what this individual is pointing to. Let's see. The concept can be really important when someone is, but the way that this word has taken a life of its own, it's turned into something really negative. Imposter syndrome is, so is this person using it as almost like, well, by context, this individual says imposter syndrome is a positive thing. I don't know. This one is, I guess, let me know if you have information on this, because I'm curious. All right, second to last term here, bipolar. This is a quote from Nilu Esmailpour, Masters of Science in Counseling, I think. And the quote is, instead of lightly throwing around phrases like she's so bipolar when referring to a friend's moodiness, we should say exactly what we mean. Describing them as being unpredictable would also work. When people use these terms incorrectly, they not only belittle the experiences of those living with the mental disorders, but also perpetuate stigma against them. End of quote. Yeah, absolutely. I couldn't have said it better myself. And absolutely, yeah. Okay, gaslighting, the final term here. This is a quote from Sarah Bishop, Doctor of Clinical Psych. Quote, "It's important to understand that simply being self-centered or having a different perspective or interpretation of events does not automatically mean someone is a narcissist and gaslighting you." So narcissist is being thrown in here. Gaslighting is a manipulative behavior where someone intentionally deceives others with the intention of causing harm. When we misuse these terms, it dilutes their meaning and hinders our understanding of the issue. End of quote. Yeah, that's pretty well said. But I actually decided a while back, because I saw this word being misused so much, and it is so important of a term to me personally and clinically, that I set out to discover or glean the consensus in the clinical literature and legitimate journals. And I developed 3 definitions based on the way it's being used. And the third definition I am only using because I feel like it deserves a place. So the first definition is the way that this individual is using it, which is legit, is that it is a voluntary campaign by an abusive person over time to make the victim feel like they are not sane, that they are not in control of their memories or their judgments, that they lack the ability to engage in these cognitive processes, which gives the gaslighter, the abusive person, control over the victim, or it's an attempt to gain control. Because if you can tell the victim that I didn't hit you yesterday, that's not what happened, you hit me, you always misremember that, and if you can effectively do that, then you've really got your hooks in. So that's one, and that happens, and that's awful. And those abusive individuals come from a variety of profiles, some of which are psychopathy or sadists, some not, but that's one. But in my anecdotal and clinical experience, this is less often what is happening with gaslighting. When gaslighting is occurring, this is less often the case than the second definition, which is an involuntary, accidental gaslighting, or mostly accidental gaslighting, that occurs from an abusive individual over time. In that the individual, due to distortions, maybe a personality disorder, they are distorting things. Like an example with someone with borderline, and not everyone with borderline will do this, but just as an example, they have abandonment trauma, and so when their partner is in a bad mood or something, or just a little quiet, then let's say that this individual, let's say it's a husband, has borderline, and he interprets his wife when she is just a little quiet as that she is abandoning, and that she secretly hates him, and that she is judging him and mistreating him. And that really, so he distorts that. People will say projects, which is another word I'll get to that's misused. He distorts it, and he's also transferring and displacing from his childhood. I guess I'll just talk about projection right now while we're in this zone, is that people say, oh, you're projecting that onto her. And okay, this is not a word I'm up in arms about at all, but I like, and sometimes I will use it in that way because it just feels like it just fits. But we have a definition in psychoanalysis of projection that I think is very useful, and it's involved in projective identifications, which, if you know me, I love to talk about that. It's a concept I use quite often. And if I muddy the waters when it comes to those words, then it is harder for me to think and harder for me to communicate. Anyway, often when people are using the word projection, what they are technically, in my language system, or not my personal, but in the psychoanalytic and the more general psychotherapy realm, the word that's better used is displaced or transferred. So, or distorted. Those are the three. Anyway, so for the borderline husband, he is transferring his parents who abandoned him onto his wife. He is distorting what is happening as not only an abandonment, but a massive judgment and hatred from her. And then he is very hurt by that, and also very angry because it's completely unfair for her to do this to him. She's not doing it to him, but he knows that she is. So then he starts to go after her and say, I can't believe you're doing this to me. Look at what you're doing. You're always doing this to me. You said in therapy last week that you were not going to do this to me, and you're doing it to me again. And the wife is like, what's happening? And he's like, you're always abandoning me. You promised me that you loved me and you weren't going to do this to me. How dare you? You want to go out with your friends tonight, and you're probably just going to cheat on me because that's what you're always thinking about, just da-da-da-da. Okay, so if this individual, and this isn't a characteristic of borderline, the abuse cycle that I'm talking about, that's also modeled to them growing up, but you get the picture that if this was unrelenting and constant, that over time, the victim, the wife, would potentially eventually start wondering if she is a bad person, and if she is abandoning him, and if she does want to cheat on him, and she is unfair to him. without outside support, without her own support system, it's really easy to start to assume that. We are not individual creatures. When the collective believes something, and if the collective is just two people, then it's very hard for us to push back on that narrative, especially when people are very certain of it and we are not. We tend to bias towards the certainty person. Well, that person seems to really know. I'm only like 80% sure of my side, but they're 100% sure that it's this other thing. So I guess we'll go with that. And over time, that can be gaslighting. The borderline husband is not consciously setting out on a campaign to gaslight, but it is gaslighting. And I think this is very important to understand, not only just so that everyone understands the nature of abuse and of abusive individuals, which I don't hear a lot of people talking about, even in the domestic violence, intimate partner violence realm, which is surprising to me sometimes. And this is just anecdotal. But anyway, the third definition of gaslighting that I initially rejected but eventually adopted is systems of power organizations that will effectively gaslight an individual, sometimes voluntarily, but usually not consciously. Like an example is in the military, you have, and not every military organization or subsection is like this, but you can imagine that you have a old school culture within a military organization, like say on a Navy ship or something. And you have a male commanding officer who is sexually harassing, maybe even assaulting the women, the few women that are in the unit. And the woman comes forward, one of the victims, and the system conspires because of a lack of the ability to, because you're talking about your superior officer, and you would be reporting to your superior officer, but your superior officer has a superior officer, and that was the person who actually assaulted you. So you're telling someone above you, but the perpetrator is above them. So now there's changes in the military in the U.S. to account for this, which I applaud. More work needs to be done. But you can imagine a situation where you have an organization and a structure and a pattern and a culture that could effectively make the victim feel like they are complaining too much, or that they must have wanted it, or they're too weak to be in the military. If they can't handle that, then they can't handle, you can just imagine, and that's happened. I've heard from victims who have had that experience, and they had all the signs of being gaslit over time. But it wasn't an individual. It could be, right? You could have a commanding officer who actually sets out to do this. You could even have a collective organization that at least halfway consciously knows this is what's happening to people. That's not a far-fetched notion. But even without that, even if everyone consciously is trying to do right, if you have a system and a culture, and out of that has this gaslighting effect, then it can gaslight. So that's the third definition of gaslighting that I will use. And I could see how some people could say that third definition is a misuse of the term and is muddying the waters. I don't think so, because we need another word for it, because what I say is I don't say gaslighting. I will say voluntary gaslighting, involuntary gaslighting, or systemic gaslighting. I don't ever just say gaslighting, or unless it's clear by definition what I'm using. Now, this term is one of those terms that has really bothered me in how poorly it's being used. And so if we get back to our criteria, is it being misused? Yes. How is it being misused? People are using it as a stand-in for just lying, or thinking that someone is trying to deceive you, right? Like you're in a conversation, like I'll never forget this one time. I was reacting to the Frenemies podcast with Ethan Klein, and I can't remember the woman's name, but they were having an argument, and I think one of them was saying, well, earlier you were angry. It seemed like you were kind of angry. And then the other one was like, I wasn't angry. What are you talking about? And then I think it was Ethan, he was telling her, no, it kind of seemed like you were angry. I know you're denying it, but I think you were angry. And she said, you're gaslighting me. Now, could that be gaslighting if it was one snippet of a larger pattern of abuse? Because if there's gaslighting, there's also a lot of abuse that is happening. Maybe not physical, but maybe, right? So if it's a part of you can't just gaslight someone and alone, like or at least it's not typical, right? I've never seen a case where there's just gaslighting and not some overwhelming, obvious pattern of overall abuse, verbal, emotional, physical, sexual, financial, whatever. So could it be a snippet of an overall pattern of gaslighting and abuse? Maybe, but probably not. And so when she's like, you're gaslighting me, because from her perspective, she believes that she wasn't angry. And from my memory, I kind of felt like maybe she was angry, but of course I can't know her until, but anyway, she was saying, you keep saying that I was angry, but I'm not angry. I wasn't angry in that time. I'm angry now, but I wasn't angry then. You're gaslighting me. And, I get it because it feels hurtful or nefarious or purposeful or manipulative, right? So I wish that people would just use one of those words. You're trying to manipulate me, or you're trying to trick me, or you're lying to me. You're proposing a story that I just know not to be true, and you're hammering it into the narrative, and it's not what actually happened. Take it from me. I know if I was angry or not. To use gaslighting, it does that. Is it imprecise? Yes. Is it wrong? Yes. The wrong definition. Does it cause harm? Yes. Because I know from people who have been gaslit and have used that term in their recovery and in their narrative and in their therapy and in their PTSD treatment, for them to hear people using the word gaslighting in that context is very hurtful to them. They're just like, do you not understand what gaslighting? That's not gaslight. Again, that's like if someone had a minor pain, temporary pain in their knee, they're like, oh my God, my cancer. It's so cancerous, my knee. And from the outside, you're like, what? So that is not okay. And then in this exchange from my memory, she starts to say, no, I wasn't angry. You're gaslighting me. And then shortly after, Ethan, I think from my memory, says, you're gaslighting me by saying you weren't angry at the time. So this other usage is just like trying to cover up. You're just lying. Just say lying. There's not a lot of ambiguity to the word lying, or you're trying to deceive me, or you're in denial, or whatever. There's a lot of different words for this. You don't need gaslighting. And this is, I've said this before, but I suspect that what happened was that, because the word gaslighting has been used in the intimate partner violence literature and treatment and discourse, I think for decades, from my memory when I looked it up. And I think that someone overheard a conversation about gaslighting and misinterpreted the definition, but gleaned enough from context that it had to do with deception and lying and purposeful manipulative narrative forming, right? And when they ran into a situation where they felt like they were being deceived and manipulated, they wanted a powerful word. And they gleaned from the discussion of gaslighting that it was a powerful, very toxic, very severe word. And today, when you say someone's lying or being manipulative, because those words have been overused, then people feel like to say lying, that doesn't pack enough of a punch. And to me, that's a problem, because lying, an accusation of lying should pack a massive fucking punch. For someone to lie manipulatively should be a horrible accusation, should be a significant claim about someone. And within conversations online or within conversations personally, that should be sufficient. That word should be sufficient. It's not. So people are grabbing other words that they perceive to have more punch, which they don't necessarily, And they use gaslighting. And then people just run with that, right? And that happens with a lot of these words, right? Like to be moody, maybe people don't, with bipolar, for example, it's like they don't have the words, or the words have been diluted so much that they feel like they need to grab for clinical words. I think that happens a lot. All right, so that's the end of that article. And I thought I would actually diverge from the article and just talk about other words that we haven't talked about yet. And this is, again, not an exhaustive list, and it's also not an exhaustive review of each term. But the first one I want to talk about is narcissist. I hear this very frequently. I'm very surprised it didn't show up on this article, but, it's just an article that someone wrote. They did their work it sounds like they interviewed a lot of people. I'm not an author, but this author put in a lot of work to compile these quotes. I think they actually reached out to these individuals. You would just think that they would also just add a couple sentences of their own opinion, just add their own thoughts to or a summary. Like there's no conclusion. There's no intro. It just launches in anyway. So what are you gonna do? But the terms that I want, so narcissist is the first one to emphasize here. And the way that people use it is false in that, okay. So first off, like with trauma, let's talk about the history of the word narcissism. In brief, and I'm really only going to highlight the last 100 plus years or something. But in terms of, let's see. I will just talk about the legitimate usage within the clinical literature of the term narcissism or narcissist. And I'm not a fan of narcissist because, I don't know. It's like, I don't call someone suffering from borderline, I don't call them a borderline-ish list, or, you know what I mean? It's just, they're just someone suffering from narcissism, someone with narcissistic traits, or I don't know. So a narcissist, and I could be proven wrong. I mean, maybe in the past in the podcast or teaching, I would use that term, but to my memory, I don't. And anyway, but I don't have a big deal with that. It's more of just that it's being misapplied. And I see increasingly being misused by clinicians and clinicians online. So narcissism, what is it? Well, in the clinical literature, there are multiple definitions, and I reviewed all of these in my deep dive on narcissistic personality disorder. If you want to be a patron, if you want to listen to it, you have to be a patron. But from my memory, and also just from my own daily use of the term, we have the use with narcissistic personality disorder, which is a frequent topic for me on this podcast and YouTube channel. So there's that. I won't go into full detail on that, but generally speaking, it's someone who has significant relational traumas growing up, usually neglect, that causes them to turn inward and to rely on exaggerated, grandiose sense or superior notions about themselves. They need this to be true because if they don't engage in this fantasy, their whole life will fall apart because they're alone and anxious and scared and neglected. They feel like they don't deserve love and attention and security, and that must mean that they're inferior. They're not good enough. So they have to counteract that with this very thin veil of a defensive structure. And a part of that means they have to convince other people. And a part of that would be facilitated if they actually establish themselves as being superior, like earning more money or earning a political office, this kind of thing. So that's one use of narcissism. It's the most common use that I'm using. There's another way to use it, which is in the sense of like the dark tetrad or dark triad sense, where you have narcissism and psychopathy and sadism and Machiavellianism with the dark tetrad. And this is very related to narcissistic personality disorder, but it's more narrow and can be related to the processes of psychopathy, meaning that if you lack empathy, you might also, by a function of your lack of empathy and lack of care about other human beings, you're more self-centered. And so it's not the narcissistic personality disorder syndrome, it's just born out of a general lack of empathy. but it also could be born out of the same place when we're talking about dark tetrad. But generally speaking, when we're talking about all those terms, when we're talking about sadism or when we're talking about psychopathy in that context, and it's weird because it's the same word in the clinical literature. If you can see one article say narcissism, and what they're referring to is narcissistic personality disorder, which is kind of an elaborate, specific usage, or they could be using it in this clinical sense as it relates to the dark tetrad. That's all I'll say. The other way it can be used in the clinical literature, narcissism, is the kind of usages with, I think her name is Twenge. She is one of the popular researchers when it comes to narcissism, specifically looking at trends over time and using this narcissism measure that is a very quick survey on how narcissistic one is. I can't remember the amount of questions, but it's like 40 to 50 questions, true or false questions, I think, from my memory. And it is supposedly a measure of one's narcissistic intensity, how narcissistic that individual is. There are massive problems with that. Most notably, there are a couple items on this measure that are very clearly measuring something other than, or could be measuring narcissism, but also could just be measuring self-esteem. Things like, I am important or something, right? I can't remember the exact item, but if you have someone, so one of the things that they have found, Twenge and colleagues, according to their data, that young people today are, quote unquote, more narcissistic than people 30, 40 years ago. I can't remember the exact claim. There's a number of different studies in this direction. And this researcher, of course, is propped up, particularly on right-wing media, but just really media in general, because it really plays into the notion of kids these days, right? And social media is ruining the personalities of these people, influencers and all this kind of, and it's just a current manifestation, and maybe there is something happening with our society right now, but it's really hard to measure this. And more often than not, when we look back at history, when clinicians and researchers are pointing at data indicating that kids these days, when you look at it now, it's just quaint and silly, and you think, oh, I think you were biased just against young people. So so with this concept, they are not researching narcissistic personality disorder, even though they might word it this way. What they are really talking about is just a more narrow, potentially non-pathological self-centeredism. Like when it comes to ideas of, like if you talk to young people today, they are much more likely to want a career as an influencer or as a YouTuber or something. I find this actually, as an old person myself, I will occasionally, like I recently had someone come over to work on the house, and he was younger. I think he might have told me he's like 20 or something, because we chatted about various different things, and he asked me what I did. And I find that when younger people come over to my house and they look around, especially at my equipment, like what I'm recording this with, they will say, "What do you do?" And I'll say, "Oh, I'm a podcaster and YouTuber." And older people my age and up will go, "Huh," but younger people will go, "Really?" Because I think for a lot of people, they just live in that world. And I would react that way too, incidentally, because I live in that world, even as a consumer. But anyway, so one could say, and so for these individuals, there's a greater rate of younger people who want careers where everyone looks at them and listens to them, like what I do. So one could say, in terms of a broader non-pathological definition of narcissism, that's a trend in an increase in narcissism. It's an increase in being self-centered and being wanting to be the center of attention. Okay, that is another definition of narcissism. It's not necessarily and really far afield from the definition of narcissistic personality disorder, even though we're using the same term. So that's why when we use narcissism, we really have to be precise. We have to give a lot of caveats because in the clinical literature, these various different definitions will occur. And among the public, they, of course, don't know this. And I see among clinicians, they also don't understand it. So that's another aspect. Another word for another definition of narcissism that is legitimate is the general tendency for humans to be self-centered and self-interested. And you can talk about the developmental aspects of this, that, younger children are more self-centered, more self-interested, more selfish, less altruistic, less ability to know or care what other people are going through. And we want young children to be in that space because they aren't mature or ready to absorb the pain and the responsibility of taking care of other people's feelings, like their parents, this kind of stuff. So that is another usage of narcissism. It's not pathological in the least. In fact, it's encouraged. It's a sign of developmental health that you have a 5-year-old that is more narcissistic than they will be when they're 25. So that's another usage. It's typically not used in the public discourse, but it is one of the usages. I think that in recent decades, they've moved away from using the word narcissism because of that confusion, and they'll use words like more self-centered or something like that. And yet another usage of this term, narcissism, in the clinical literature has to do with Heinz Kohut, or Kohut, as sometimes, I don't know the official pronunciation of his last name, but he was a prominent theorist and therapist he's considered to be within the broader field of psychodynamic therapy or psychoanalysis. And he wrote a lot about narcissism, and I don't have time to go into it, but it's related to everything that I've been talking about. And he, don't quote me on this, but I think he might have coined the term narcissistic rage, or anyway, he centered a lot of his thinking, and he saw a central or a common feature among his patients around narcissism and around how to help people to recover and heal by entertaining the client's narcissism as the psychoanalyst. You want to, from my memory, I feel like I want to look into this again because I used to study him and because I liked a lot of what he talked about. And so don't quote me on this, but the vibe that's coming in my memory right now is that he recognized that a lot of his patients needed to regress developmentally to a more younger place in which they were more self-centered and more self-interested. And if they weren't allowed to be that way when they were young, then it was the psychoanalyst's responsibility to return to that place so that they could be kind of reparented in that way. And instead of confronting a client all the time about being unrealistically self-centered, you actually have to go with it and entertain their self-centeredness to help them develop past that self-centeredness. Anyway, I could have all that wrong, but just know that there's a whole Heinz Kohut topic of narcissism that's related to all this, but it has a lot more psychoanalytic jargon and stuff within it. Anyway, so I hope that's all. That was all off the top of my head. I wasn't looking at any notes for that, so hopefully that's all on the up and up. But another word I want to talk about is ADHD. People will say that when they don't have ADHD, they will be distracted, right? They will be, say, in a meeting at work and they are distracted by a notification on their phone frequently, and they're like, oh my God, I'm so ADHD. I think, and I've heard people with legit ADHD who suffer greatly and have suffered greatly, that when they hear people say it like that, it'll hurt their feelings. It'll make them feel like their condition is not understood, that it's just, or some people will even use ADHD in a sense of it's like a strength of theirs, that they're kind of type A personality where they're very active and social. I don't know. So I think we all understand how that word can be. I don't hear people using it that often in that way, though. Another word that I want to highlight is sociopath. I'm not a huge, I'm not terribly upset about this, but it does kind of irk me because in the clinical literature, and the problem is that not only do people, okay, so where do I begin? The history of the terms antisocial personality and sociopath and psychopath, these are all related. A lot of people consider them to be essentially the same thing. Some people don't. And it depends on how you're using it. Like if we're using psychopathic personality in the hair sense, the hair measure, the items, that's a very specific condition that is very clearly a subset of antisocial personality. But you can also just talk generally about psychopathy as a lack of empathy and use it as a synonym for antisocial personality disorder. So it's kind of all over the board. And I've done a whole deep dive on these three terms that you can listen to if you search for it. I think it's just called psychopathy versus antisocial versus sociopath or something like that. But anyway, so sociopath is in the clinical literature. You would think we would have clear definitions for this, but it's not, because it's socially constructed among clinicians. And that's even what we call these words. We don't call them, concepts as much as we call them constructs, because these are ideas that are constructed, through clinical wisdom and research, but they're not a thing. It's, to talk about cancer, we're just labeling something that is real. You can point to it and touch it and look at it, right? Under a microscope, or even just macro level, you can look at it. When it comes to something like psychopathy, you can't look at it, you can't measure it, you can't poke at it, you can't take a blood test for it. It's just a construct of our ideas that help us with treatment and research and conceptualizing things. But it could all just be bullshit. We could just be misperceiving. We could be lumping 10 different things into one thing. We could be biased, and that's happened in the past. We've had diagnoses that would say that if you're gay, that is a psychopathology, because we construct our labels out of culture, and if our culture's fucked up, then our labels will be too. So we can never know if we're doing that right now. We just have to recognize, and we recognize it through that language of calling it a construct. Anyway, so when it comes to sociopath, though, I read a lot of the clinical literature, not just about this debate, but also like how are people using these terms. And in the clinical literature, the word sociopath, among the more high level, but how do I measure that in terms of the clinical literature? Anyway, that there are very few authors that will use the term sociopath. And of those that use the word sociopath, they will use it either just as a synonym for psychopath or antisocial personality, or they will use it as a different construct, a different condition than the other two, in that the individual has had to develop a lack of empathy to survive, but fundamentally they do have empathy, like someone that grows up in a war-torn area or someone that grows up in a gang community. They might develop sociopathy in that they lack empathy and they are callous about doing murder or drive-by shootings or something like that. But fundamentally, personality-wise, they do have empathy as exhibited by their other relationships. It's not general to their personality. They've had to adopt a sociopathic mindset to survive. And it also, is possibly affected by habituation and culture and normalization and all that kind of stuff. And so for these people, it's thought that they can be reformed fairly easily compared to the others. You take them out of the context and you help them recover, and you can rely on their foundational personality that possesses a lot of empathy or normal range of empathy. Okay, so there's that. And there's also, like I said, the use of sociopathy as just another word for psychopathy. And then with antisocial personality disorder, which is in the DSM and otherwise, is a broad term for someone that lacks empathy and engages in criminality and maybe exploitation of others, this kind of thing. With a psychopath, typically in my world anyway, we tend to use this to be a narrower version of someone with antisocial personality disorder. And for these people, they personality-wise have a fundamental lack of empathy for other people. And for the psychopath, they have a fundamental compulsion to exploit other people. People with antisocial don't necessarily have that. Okay. Now, this is different from sadism, which is often not talked about. It's often rolled into these things, but it's well understood by researchers that it's different. There's a lot of overlap. They're correlated. To have psychopathy or antisocial personality, you have a much greater chance of also having sadistic personality, but not necessarily. And you can also have sadistic personality without being a psychopath. You can have pleasure in harming other people and yet also have empathy. That happens sometimes, and that can really screw up someone's head. Anyway, so that has to be differentiated as well. But when it comes to the word sociopath, I know what people mean by it, but and for the general public to use it, I get what they mean by it, and I'd much rather have them use that word than narcissist. Oh, so how do people misuse narcissist? The way they misuse it is that it has morphed over time, over the past, I'm thinking 5-10 years, where today 99.999% of people that are using the term narcissist, what they're actually referring to is a sadistic psychopath. Literally, that's what they're referring to, is someone who takes pleasure in harming others, someone who has no empathy, and is actually trying to harm you. They go on a Machiavellian mission to harm you because it pleases them to do so. That's what they mean when they're saying a narcissist. And that's not what a narcissist is. I don't even know what, especially when I think about all the different usages in the clinical literature about narcissism. What is a narcissist exactly? Anyway, so there's that. Okay, so getting back to sociopath. I'd much rather have them use sociopath than narcissist because at least that's closer to the mark in terms of what they are actually trying to say. Now, are they right in labeling someone as a sociopath? No, typically not. So in terms of being it related to psychopathy or antisocial personality. Anyway, so, do I think that this hurts people's feelings? Probably not. Because if you have antisocial personality or you are psychopathic, you probably don't label it that way, and even if you do, you're probably not talking about it openly, and it might not, bother you. I guess getting back to narcissist, I am seeing an increasing number of people who are identifying as having narcissistic personality disorder, including my own clients, and they are not worried about that term. And so when the word narcissist is thrown around and used as another term for sadistic psychopath, for those people with narcissistic personality disorder, it does hurt their feelings, which is unfair. So this is just, with sociopath, it's just kind of a pet peeve. It's not really a huge thing to me, but and I've said this before, that for a layperson to use it, okay, whatever. But for a clinician to use the word sociopath, without, if I heard a clinician, and I hear this sometimes, they'll say, okay, I'm using the word sociopath to mean someone that has had to develop a lack of empathy and callousness because of their surroundings. That's my usage, so that I'm going to use it in that way. And I'm differentiating from psychopathy or antisocial in this way. And sometimes in the clinical literature, they will do that. I'm totally fine with that. That's fine. But what I will often see clinicians do, and it's usually like influencer clinicians that will use sociopath casually as what I think what they mean is that they mean a psychopath. And I find that to be disappointing and spreading. I mean, it's not horrible misinformation, but it's a part of the weirdness of the public misusing our terms. So if a clinician clearly defines sociopathy, and I could see a clinician online even saying, look, I like the word sociopath because that's what I come up with, and I'm using it as a synonym for psychopath for those of you out there. Then okay, you've defined it, you've told me what it was, but that's not what I see. What I see is people just using that term, and what I think is happening, what it is an evidence of to me, and I don't know this, but it's a tick in the column that this clinician doesn't know what the fuck they're talking about. because the word sociopath is being used mostly among people that don't know what they're talking about. I guess that's what I'll say is that, and I've said this before, that if you want to look like a hack in my field, to me anyway, use the word sociopath and don't define it, and just operate like everyone understands what you mean by it. That is a hacky thing to do, because I don't know a single expert in the field of psychopathy and antisocial personality that would do that. So, yeah. All right. Another word here is the word abuse. That is often overused as well and can harm people who have actually been abused. Like I don't even have to give an example. You can imagine examples of people saying, oh my God, like I was so abused yesterday because this minor thing happened. And now the word abuse was co-opted by the clinical world. So this could be one of those words where it's like, well, like if someone abused their car by, driving it to its limits or something. Well, that's an inanimate object, right? You can't psychologically or physically abuse a thing that doesn't have feelings, right? So, maybe this word, so I haven't given this one a lot of thought. So if someone wants to use it from that point of view, right? So I don't know. But I think that if the general public, if lay people are going to say, oh my God, I was so abused because, I don't know, my boss won't let me wear that shirt to work and I really like it because it's my comfy shirt and he's abusing me. Then, I think it's just one of those usages that it's like, just use a different word. Like it's really getting under your skin, or it's bothering you, or it hurts your feelings. Just say hurts your feelings. Anyway. Okay. So I want to talk about the word grooming. So there are 3 definitions of grooming that people operate from. One is to physically groom yourself, like you're shaving yourself or something, you're grooming. Another is to, and this is just off the top of my head, so I might miss some things here, but another word for grooming is to groom an individual for a higher position, like when my mentor, Paul David, who passed away recently, tragically, but when he groomed me to become program director, I might have used the word grooming in that context. The other usage is in sexual abuse situations that the perpetrator will groom victims, meaning that they will gain trust by slowly manipulating an individual to be more easily victimized, right? And typically with grooming in that context, we're talking about children, but sometimes people are talking about adult to adult grooming. But typically in my field or in my circle, if someone said, and I didn't have any information, I was just like, oh, my client groomed someone, I would assume they're talking about a child. But, of course, we'd have to elaborate if it was necessary. Anyway, so those are the 3 definitions. There's probably others, right? But, those are the 3 main ones that I can think of. And how is it being misused? Well, it is being misused by, at least this is just in my cultural pocket or what I see, it's being misused by nefarious right-wing people who would say that to have a drag show or something in a community, they are obviously grooming children so that they can sexually abuse them or something like that. And yeah, I think they're using the word accurately in that they are operating from a legitimate definition. They're just throwing it around in a disingenuous, potentially manipulative, and just transphobic way in that specific example. So yeah, but I feel like I've seen people use the word grooming in these very minor situations, like if someone online is being nice to another person and a stranger, like in a comment section, and then a third person says, that person's obviously grooming you. And you're just thinking, well, even if that person is being manipulative, is there any effort to meet up in person or to actually have contact with a person so that they can abuse them? It could be manipulative, but is it actual grooming for abuse? Anyway. All right, so that brings us to a term I want to really talk about, which is intrusive thoughts. I've seen more and more people recently talking about how this word is being misused. So and this is just, and I haven't looked up all the clinical literature, but in my cultural pocket, intrusive thoughts are legitimately used in two different ways. One is in the psychopathology sense, like with OCD. In fact, we heard when we read that quote about OCD that you can have intrusive thoughts, meaning that they're intense thoughts that are overwhelming and will, in all likelihood, eliminate the possibility to think about anything else. And they will come out of nowhere. They're unwanted, but they aren't going to go away until you engage in the compulsive behavior like cleaning or counting or whatever. So that is, there's a lot of suffering involved in those intrusive thoughts. And that's the term that in OCD treatment and discourse, they will use that term, intrusive thought. But there's another legitimate definition, which is an intrusive thought of just like you are, you've been cheated on by a past partner and you're with your current partner and your current partner goes on vacation and you have an intrusive thought that they are going to cheat on you. I don't know of a better term. I think that is a worthy term. It's a term that's been used in that way for a long time. I don't know the history, but I could imagine the OCD discourse actually adopting a term that was already being used more generally in psychology along these lines. I don't know that. But I think that intrusive, because what people will say is, don't use intrusive thought in that way. That, like someone will say, oh my God, I went to the store and I'm having intrusive thoughts of buying things and I don't want to, I want to be more on budget or something. And what I will hear is people will clap back and they'll say, don't use intrusive thought that way. It's a term in psychopathology or with OCD or something. How dare you minimize my experience? And I'm open to that. I'm open to hearing about that. But to me, if someone's going to say that, oh my God, I'm so OCD, well, there's no other way to look at it other than that you're minimizing, right? If it's like, oh my God, I'm so OCD, I like to have an organized desk, and that's it, right? And they don't have OCD intrusive thoughts about it, right? Then for someone to say that, there's no other way to look at it other than that they either misunderstood the term and or they are minimizing the experience of people with OCD. For someone to say that they're having an intrusive thought of buying things when they go to the store, but they're trying to stay on a budget, I just feel like there's a lot of legitimate use. It's a thought that's intrusive. It's a thought that is not, how do we define a thought that we chose to have or, it's an unwanted thought that's, coming forward and it's compelling us to do something or it's compelling us to think about something that we don't want to think about. And it could either be a minor experience like going to the store, or it could be a major experience like that with OCD. So to me, I'm still kind of working out my thoughts on this, but I, at this point, am not a fan of people clapping back at that. And it almost feels like there is a certain group of people that have absorbed the discourse around clapping back at, am I even using that phrase right, clapping back? There's a group of people that I think are operating from a place of goodness in that they see people misusing OCD and other terms, and they're trying to police that in a good way, in a helpful way, in a socially just way, and they have just turned their crosshairs on the usage of intrusive thought. And I think that there's a possibility that that's misguided, but I could be convinced otherwise. The other word that I want to talk about is dissociate. So I see people getting upset about the usage of this term as well. And I haven't looked into this recently, but I'll tell you that I know that the word dissociation comes from early psychology and psychoanalysis, and it was adopted by the DSM to describe very specific intense pathological experiences, that of dissociation, and not just dissociative identity disorder, but a whole suite of different dissociative conditions that are really quite horrible. But the word dissociation remained as a general word within psychoanalysis to refer to pulling away from the situation mentally as a protective measure, whether it be a small dissociation or even just a a phenomenon of the scenario. Like a dissociative experience that people will talk about is when you're driving to work and you've driven this route thousands of times, you zone out and you don't pay attention. You're on the highway and you don't really pay attention because you know it so well, you can do it without even paying much attention. Now, that can lead to bad things, because if an anomalous thing happens, like a car pulls out or there's construction or something, then you're behind the wheel of a machine that's careening down the road at 60 miles an hour and can kill you and everyone else. And so you want to be careful. But anyway, that is not a pathological experience to zone out while you're driving. So the dissociation or dissociative experience is a general thing and not necessarily a pathological thing. And so I've heard some people clapping back, if I'm using that phrase right, at people using a more lighter version of dissociation and say, hey, don't use that word. And I'll even see people thinking that dissociation is only referring to dissociative identity disorder, which is not the case as well. So I don't really know where I land on this one, but I just wanted to point that out. Another word is mania or manic. People will say, oh my God, I'm so manic because I have energy. And this is similar to dissociation in that the term mania, or the older diagnosis of manic depression, it's probable, I don't know, that the people that came up with this language in the 20th century, they were just using a word that was already being used in society, sort of like attention deficit hyperactivity disorder, ADHD, right? Well, we don't, and I don't think anyone does this, but we don't want to say that to be hyperactive only refers to ADHD, right? You can look at someone and say that, oh my God, they're hyperactive, or I feel hyperactive today. And you're not saying that you have ADHD, and you're also not demeaning people with ADHD, right? So when it comes to mania, just because someone's using the term, someone is manic, doesn't necessarily mean that they're misusing the term, and it also doesn't mean that they're demeaning other people's experience. I don't hear people doing that very often, but I just wanted to point that out because it's one of the words that I see people getting upset about at times. Another word is love bombing, and I've done a whole deep dive on that, and I talk about it occasionally, but very briefly, love bombing, like with gaslighting, I have found important to delineate between voluntary love bombing and involuntary love bombing, and also differentiating it between just infatuation love that doesn't have any love bombing aspects to it, but could be mistaken for love bombing. But anyway, my definition, based on the way it's used in the clinical literature and the way that it's legitimately being used in popular culture, is that when someone is purposely trying to manipulate another individual to abuse them or control them, they might engage in love bombing, and they know they're doing it. They're not really in love. They don't really care, and they are legitimately trying to manipulate and trick someone. Okay, so they shower the individual with affection and spend a lot of time. You're the best. Oh my God, I'm so in love with you, or you're so great. Because you can also have a religious figure that does this, or a boss at work that does this sort of thing. Okay, so that's purposeful. But in my anecdotal experience, that's rarer than the more common of involuntary gaslighting or unconscious gaslighting, or love bombing, when you have an individual, let's just take someone with borderline because it's easy to, see how it could come out of it. But love bombing, involuntary or unconscious love bombing can come from a lot of different conditions. Well, let's just talk about something more general and common, like preoccupied or anxious attachment. So for this individual, they had inconsistent parenting and attachment security such that they adopted a defense of being hypervigilant and worried about attachment loss. and constantly looking for the possibility of being abandoned, and they feel like they have to game the system in order to gain attachment security. And they also have a lifetime of not having a lot of attachment security. One, because when they were being raised, it was the way they were being treated. But two, as an adult, due to their anxious, preoccupied attachment, they tend to push people away. And so they haven't had secure attachment. So when they meet someone that might actually be a secure attachment object, they pour a lot of their energy into it because they believe, rightfully so, that this person might be able to provide them the attachment security that they've never had. And so they have overwhelming feelings of love and hope and attraction. And so they legitimately feel all of those infatuated feelings. But because love bombing is differentiated from just falling in love, in that the love bomber won't actually listen to the target in terms of their preferences. So if someone's just in love and they're just like, oh my God, you're the best. I think about you all the time. All your jokes are funny. You're the most beautiful creature on this planet. I want to spend all my time with you. I want to move in with you. I want to marry you. I want to have kids with you. This is the way. That's also just falling in love. So what differentiates that from love bombing? Well, when the target pushes back and says, I want to go slower, or I don't want to do it in that way, the person who is love bombing will actually get upset, and they will engage in coercive behavior, abuse or intimidation or pressure or something. That's not really loving the person, right? That's loving an outcome that you need to happen. You might also love the object, the person, but you're operating from a place of desperation that will cloud your empathy or judgment or needs, really. And so for the preoccupied, anxiously attached individual, they might legitimately love and depend, but there's a part of them that is rigidly holding to a rapid onset of attachment security, and they will not abide by the other person's request to slow down or to do it in a different way. So that's my definition of love bombing. I don't hear people, and similarly to gaslighting, I don't hear people even in intimate partner violence circles using it in this way, and I don't know what to make of that. Maybe it's just the people I hang out with or something, but I don't know. But so how do people misuse this term? Well, so the clinical literature tends to use love bombing in the voluntary sense. Sometimes they're, I think, referring to the involuntary, unconscious sense of it as well. But anyway, so how do people misuse it? Well, they'll misuse it to refer to, like, I remember there was a friend or a friend of a friend that was confiding in me, and she's saying, I was love bombed by my boss or something like that, someone in power over her life. And she said that, they had a tumultuous relationship, and at first was voluntary for her, but then he broke up with her or something. And then she tells me I was, he's a narcissist, and he love bombed me, and he gaslit me, and all these words. And, I'm not at work in that moment, so I'm not asked to fix anything. But I was, in conversation and being supportive, I picked up on a lot of details that pointed in the direction that would not, in my mind, justify, applying the term of love bombing. What it looked like was that you had someone who was in power and should not have engaged in a romantic sexual relationship with a subordinate, and might have been using their power to, in fact, probably was using their power either on purpose or otherwise to get their needs met, and legitimately fell in love or in like. And the woman that I was talking to legitimately fell in love and maybe had more feelings for him than he had for her. And then eventually one thing led to another, and he broke up with her. And
I didn't see any hallmarks of abuse. And what I perceived was, from her standpoint, she was really hurt by being broken up with and humiliated. And it also really affected her work life, right? And she was still in contact with him, so she saw him dating other people after they broke up and concluded that he never loved her and he doesn't love any of these women that he's with. But I didn't hear any indication that that was necessarily true. Could it be true? Yes. But this is the nature of people's assumptions, and it's normal for people to do this. You know, when you get dumped, it's very hurtful, and if there's not enough conferring or talking about the breakup, it's very tempting to conclude, particularly if you have past relational traumas along these lines, that the person never loved you. And if they never loved you, then they must have been purposely manipulating you. And if they're doing that, then they must be a psychopath, or what the internet will call a narcissist. And it's all a big lie. And so, but what about all those loving things that I was being told and shown in the beginning? Well, it must be love bombing, right? It must be manipulation. And it could be true, of course, and it happens, unfortunately. But also, sometimes people legitimately fall in love with each other, and then one person decides to break up. And it's not love bombing. It's just the regular process of falling in love and changing your mind, which unfortunately happens, you know. So that's what I'll see. Now, I want to be clear. With that woman I was talking to, I'm not confident in my take. I'm just saying that it's just an example of this over-applying of the term to any situation in which, from the outside, it looks like someone had the behavior of love of another, but then later changed their mind, or things changed, and then they must not have really been in love. You know, that kind of, anyway. Or another use that I'll see people use is that if you have, say, someone online who is being nice to another person, and they also kind of want something from that other person, and it's very mild communication, then it'll be accused, you know, the individual will be accused of love bombing, when it's just like, well, you know, they're just trying to put on they're just trying to put their best foot forward, that kind of thing. I think another misuse of the term is when someone is just very expressive in dating and they really like you, and they are complimenting you a lot, and they wear their heart on their sleeve, and they don't hold back, and they don't have the hang-ups that other people have. They might have the opposite, oversharing or something, and they'll be labeled as, or at least they'll be suspected of love bombing, when it could just be that the person's just really expressive with their love, you know. So there's that. The last word I want to talk about is the word antisocial. And this is a minor one, but people will say antisocial when they mean asocial. So when we ask ourselves, are they using it imprecisely or wrongly? Yes. When people are saying antisocial and they mean asocial, then yeah, that's a gross misunderstanding and misuse of the term. Is it actually causing any harm? I don't think so. That's not a big deal. Now, the reason why I will correct people, like I'll correct people, like I recently Umberto said something like that. He's like, oh, you know, and I said, you mean asocial? It's because I have a psychology podcast and YouTube channel, and I want people to understand the definitions of these words, and I don't want that to just go flying past me. But if I was on the bus or something and someone misused, or if I was at a party and I heard someone, and this happens, you know, actually, I don't correct them because it doesn't matter. I guess that is a good question. It's like, if I'm at a party and someone misuses these terms, which of these do I think warrant me having the very awkward exchange of correcting someone? That's a tough one, because I am a bit conflict avoidant. I think I'm in the normal range for that. I think most people are conflict avoidant, and I'm one of those people. So I would say that I don't know. I probably wouldn't confront anybody about any of this stuff. So maybe I need to up the ante. If I was in a consultation group with a bunch of therapists that I didn't know very well, and I didn't have any power, we're all of equal peership, and I heard a fellow clinician in this very initial meeting misusing one of these terms, which one would I speak? I still don't think I would speak up. I've had full on cringe moments where I've had peer clinicians just stigmatizing borderline up and down, and I'm screaming on the inside and I don't say a word because I'm like, what do I do? Now, other times I will. I especially will when I have power, like I'm a supervisor or something, and I won't slam someone. I'll very gently have a conversation, but yeah, I'm trying to think like what I would get up in arms about. The OCD one bothers me, maybe particularly because it's so cut and dry. For someone to say that they're particular or they're meticulous or they're retentive or clean or something, and to say that, oh my God, I'm so OCD, and people do it a lot. It's so cut and dry wrong, and it's so cut and dry diminishing and demeaning of people with legit OCD. And I think I also just have a chip on my shoulder because even clinicians who don't specialize in OCD, they have no idea how horrible OCD is. I have anxiety and I have mild OCD. I've had mild OCD over the years, and I haven't experienced even moderate OCD, and I could tell you that even the mild symptoms I had were life-ruining. And so, as someone who specializes in this sort of thing and have talked with a lot of people about it, I'm telling you, like, OCD is just one of the worst things ever. And for someone to say, "Oh my God, I'm so," it's like, stop it. Just say, and there's so many other words. Just say you're really clean or anal or particular, or you just really need things to be in order on your desk. Just you're organized, you're meticulous, you're conscientious. There's so many other words. Just don't. Another word. I mean, sociopath will get under my skin for, I don't think, legitimate reasons. It bothers me when people downplay lowercase t trauma. You will notice that I don't even use it like that, right? Because I think we can just throw it all in, because I don't want to differentiate. It's like, let's just use and within context, let's make sure we're proposing a definition of trauma as we're talking about it. Let's see. Yeah, I think. Oh, I forgot other terms that I'm going to put on my list. Trauma bonding, which I've already talked about. The definition of trauma bonding is it's the same thing as Stockholm syndrome, right? As you're being traumatized, you bond with your traumatizer. And people use it as a term of two traumatized individuals will bond. And usually online, they're meaning it as a negative thing, that people will falsely bond, or they'll drum up trauma from their history so that they can bond with someone else or something like that. And to me, I don't mind that one being misused, because again, for people who have been through Stockholm syndrome, they probably don't even use the term trauma bonding. They probably use the term Stockholm syndrome, which in my circle is more frequently being used. And I just can't imagine that they would be that put off by that. But maybe they are. Also, I totally understand it, because if you just heard the term trauma bonding, you would think it was defined as the way that lay people define it. You would not think, because it's not a great term, Plus, with trauma bonding, we have Stockholm syndrome, which, if you know what that means, then you know what that means, and it's not being misused. So, but I don't know. I could be convinced otherwise. There's probably other words that we could put on here in terms of what culturally is being misused from psychology. And if you have any words, let me know. And that does it for this episode of Psychology in Seattle. And please take care of yourself. Engage in true self-care or true self-compassion, or getting in touch with your needs and listening to that and taking care of that, because you deserve it. You really, really do.